Good, good afternoon. As promised, we'll start the briefing off with Dr. Nabarro. He has a limited amount of time for this briefing, but I am happy to say he will be in New York much more on a more regular basis, and we'll try to get him down here on a more regular basis.
Good.
David, all
Thank
yours.
you very much indeed. First of all, it's always a joy to be here and sitting with you and working with you, and also hello to people who are connected through the video feed. I've come to join you today to bring you up to date with my work as the Secretary General's Envoy for Ebola. And I'd like to offer an update on the response to the outbreak and some of the challenges that we face. I know that you're following this very closely, and I'll try not to talk for too long and leave plenty of space for discussion. You know that during the last month and a half, we've really been focusing on mobilizing financial resources, expertise, and equipment in response to the crisis, seeing ourselves supporting the governments of the affected countries and their people. And I'm really pleased with the way in which there's been an extraordinary mobilization of cash and capabilities for the fight. It's a sort of worldwide mobilization. Governments, civil society groups, businesses. And for us, that has been a fantastic support. And so within the countries, we're glad to see that there's been more treatment and care units being constructed, staffing put into these units, and more people with Ebola able to access treatment, more of their contacts being traced, burials safer. And this is how the outbreak will be controlled. And indeed, in some parts of the region, there are suggestions that transmission is slowing. In other parts of the region, transmission is still very high. And in a minute, I'll talk a bit about what that means. We are looking all the time for trained and disciplined teams of responders. Let's think a bit about the fact that in some parts we see the outbreak curve starting to come down. That's exactly what we were hoping would happen. And I want to stress to you that just because the outbreak curve starts to come down, we start to see fewer cases in parts of the region, that doesn't mean we can stop. It's quite the reverse. We've seen from earlier information that even a few cases can reignite the outbreak. And so my instructions to everybody, and these are instructions, is stay vigilant, keep up the focus, maintain the drive. That's the only way the outbreak comes under control. And early signs of success is exactly what we expect to see. What we need to be sure is that success is demonstrated everywhere throughout the region. But don't assume that just because the numbers are reducing and there are empty beds in some of the treatment centres, that means you can take off the pressure and, as some people suggest, that you can take your foot off the accelerator. Absolutely not. Sustain the effort until every last case is identified and treated, because until then, this Ebola outbreak poses a threat to affected countries, to the region, and to the global community. You know that the United Nations Ebola emergency response has now been in action in the region for just over a month. I'm very pleased that the planning that's been done and the staffing that have been surged into the region is a common framework within which the whole of the system of the United Nations is working together. I take every week telephone call of the Global Ebola Response Coalition. And this is a combination of governments, people from United Nations, NGOs, even also some of the donors participate. And what I'm finding is that there really is a coordination of the response of very high quality. I'm very pleased that the President of the World Bank was yesterday in Accra with the SRSD, the Special Representative of UNMIR, working on ways to enhance the provision of external medical support to the affected countries. Of course, to respond effectively, we do need support from outside, and I've estimated that there will be several thousand international medical personnel needed until this outbreak is completely under control, and indeed until it's ended. But it's difficult if those who are working in the region then find that when they return to their countries that they are somehow prevented from returning through travel restrictions, or that they have some other forms of difficulty put in their way. And these returning health workers are exceptional people, and they are giving for the humanity everywhere. If they do develop infections, I want them to be properly supported and looked after. I don't want them to be stigmatized in any way. This morning, once again, the Secretary-General made the point as well, very strongly indeed. There's no scientific basis to restrict the travel of workers who've been giving service in the affected countries. There's no scientific basis for putting them in quarantine unless there is a suggestion that they might have Ebola. So if they've got no symptoms, please think very hard before putting restrictions on them. We really don't want to jeopardize the effort to mobilize health workers. We don't want them feeling that they will be made unwelcome in their countries of origin when they return. I'd like through you to thank governments and a number of foundations and also the public at large for generous contributions to the response. Most of the finance has come from donor entities, and they are providing funds through the taxpayers of nations everywhere, and it's some of the emerging nations and even poorer nations who've been providing these funds. One particular mechanism is the Secretary-General's Trust Fund, which now has received, in terms of actual commitments and pledges, an amount of around $116 million US. We've started to dispense money from this fund. We can only dispense the money that's actually there, and we will, as the money comes in, be giving it out for a succession of different projects. At the moment, the focus is on logistics services which are being put in place. So the Ebola response plan that we developed in September is still in use. We are continuing to look at whether or not the costing is right. In terms of the resources that have come in, we believe that at least 50% of what we've asked for is come in terms of commitments and pledges. And of course, the costs will increase, the amounts required will increase. That's inevitable as long as the response goes on. But we are very, very pleased indeed with the responses that are coming, and we consider that the sustained support of the international community that is necessary will continue to be with us. Thank you for the chance to make these remarks.
Thank you. Errol?
Dr. Nabarro, thank you very much for this briefing, updating briefing. Welcome on behalf of the United Nations Correspondent Association. If you can, please, my name is Errol Avdevic, I represent for Public Press. If you can please, I know there are many questions, I would just start with this one, put some more light actually on that Ebola coalition. Who is actually running the show? Are they the major countries like mentioned here before, United States or United Kingdom or others, or some other as well? And who do you like to see more involved in that? Thank you.
Can we take several questions, or do you want me to do it
If you
one
could
at
do
a
me
time?
one at a time.
Thank you very much indeed. The coalition has now met 4 times, Errol. It meets each week. I serve as the chair of the coalition, but when the Deputy Secretary General is here, I am delighted that he also will take the meetings. So the United Nations acts as the convener of the coalition. The affected governments are invited. The African Union joins. Also, some of the donor governments are there, including China, which is a key donor. They participate. Russia participates. Netherlands participate. UK, US, France. Civil society groups and NGOs participate. And there's also a group of private sector actors who are interested. They also join. It's an open group. We produce a note of each meeting, which is put out on the web, and we use the coalition just to do one thing only, which is to make sure we are working in harmony and working together in support of the countries, and if we identify problems, we deal with them. I would like to see more groups become involved, and that is going to be possible. We've got now a telephone system, which means that we can receive a large number of people participating in these meetings. I would like to continue to ask the affected countries and the people from the different agencies to give up this precious time. I know it's precious time, but I believe that it's excellent that they're there. Thank you for asking the question.
Joe Lauria?
Thank you, Dr. Nabarro. Given that this is a particularly dangerous strain of this virus, can you categorically rule out that there was any human intervention in its development? And secondly, would you recommend health workers use respirators, as this can be spread by coughing or sneezing? Thank you.
On all issues to do with the source of the infection and also means through which people can protect themselves, I asked the World Health Organization to provide guidance. And so I do not think it's right for me to make any remarks about how people should behave when they are serving as health workers. Secondly, in terms of the origin, I can simply repeat what everybody else says, that this is a disease that occurs as a result of contact between humans and animals, usually through the medium of fruit bats, and I can say no more about it.
Mr. Go, NHK.
Thank you, Mr. Nabarro. Go Kamoshita from NHK, the Japanese public broadcaster. Could you tell us how likely your target of December 1st could be met? What's your perspective?
How likely the target... Right, so let's say what the targets are, and then we can then consider whether they're likely to be met. When the United Nations Ebola Emergency Mission was set up, the anticipation is that within 60 days of starting, 70% of people with Ebola would be under treatment, and 70% of burials would be safe and dignified. The start date was October the 1st, and so the 60 days target is for December the 1st. At this stage, I can say that we are certainly on track for bringing in the people and the resources that are thought to be necessary to achieve those 70 targets, but I cannot say at all whether or not they will be achieved until we are much closer to the date. I would say we are absolutely on track for achieving them and very pleased indeed with the level of response.
Thank you. Matthew?
Matthew Lee, Intercity Press, on behalf of the Free UN Coalition for Access. Thanks for the briefing. I wanted to ask about these WHO numbers that were put out on Wednesday about Liberia, which some, even this morning, were saying mean that the corner has been turned and the number of cases are decreasing. Is that the case, and how should it be interpreted? And I also wanted to ask you about quarantine and medevac. The Philippines has said that all peacekeepers that served in Liberia and UNMIL will be quarantined for 21 days. And I wanted to know if you think if that's consistent if they don't have symptoms, and also whether national and international staff serving in the 3 countries, but particularly in Liberia, are subject to the same rules of medical evacuation in terms of if they get it, are they taken out of the country, are they treated equally, what's the situation? Thank you.
Thank you very much indeed. The figures for numbers of cases in Liberia certainly look quite exciting right now, because there are suggestions that the outbreak curve is not showing a continued increase in the way we saw during September and early October. But we have 2 challenges all the time, Matthew. The first is that you do not always each week have a timely production of the full data. So we are checking to see whether or not the data are a reflection of what's actually happening. And number 2, even if we've got a reduction in the rate of increase, this does not mean that the outbreak is under control. And so I would say that the evidence suggests that the strategy that's being pursued is the right one, that we would expect to see a slowing in the rate of increase, but we're still a long way away from being able to say either that the outbreak is under control, or most importantly, that the outbreak has ended. The outbreak ends when the last case of Ebola has been treated, and then it's gone, and we are not there. And so I'm saying to everybody, this is what we expect to be happening, but it just means we're on the right path, and we must continue and work very hard and effectively. The situation, as I just said, is that people who are working in these countries really do not need to be quarantined when they return to their place from which they have come, unless they have either a history of contact with people with Ebola, or unless they have symptoms. And the first symptom is feelings of feverishness and discomfort, and then the sign is a raised temperature. The feeling that people should be put into quarantine if they just happen to have been living in Liberia or Sierra Leone or Guinea, for us is understandable perhaps, but it does not equate with the best public health guidance. We do not, in my position at least, wish to make comments about the decisions of individual governments, because that's their sovereign right to make those decisions. All we can do is say what seems to be right or wrong from a public health perspective. We are doing everything we can in the United Nations system to ensure that all our staff, whether they are national or international, whether they are on fixed-term contracts or consultancy contracts, or whether they work for partner organizations, that all the staff who are within the response and under the umbrella of the United Nations system have access to necessary care, whether they are affected by Ebola or non-Ebola conditions. At the moment, we do not have all the elements in place for us to be able to say that everybody is able to have the level of care that we would like them to have, but we are working as effectively and efficiently as we can to get this capacity in place. That certainly applies to in-country care, which I think was one part of your question, and it also, we would like it to apply to evacuation in case of Ebola infection. I think I can say nothing about specific cases, however, to illustrate my point, because that is just not an appropriate thing for me to do. Thank you, Matthew.
Anna?
Thank you. Thank you for all of your efforts, Dr. Nabarro. And I actually would like you to address the elusive issue of self-quarantine. It's been reported that Dr. Craig Spencer, New York City's first patient diagnosed with Ebola, when he returned from Africa, he failed to tell the whole truth about his activities. And he told everybody that he self-quarantined himself in his Harlem apartment, which in fact was proved to be wrong. He used subway, he went out dining, he went even for bowling or something, and this way endangering lots of people. So we of course admire these people, these doctors who go to Africa. They put their lives at risk to save people. This is noble and humane. But when they come back and they fail to do the right thing and report the right thing, then they endanger lots of other people. And this is,
could you please find a
this
question
is
mark
not
at
their
this? Thank
choice.
you.
So my question basically is this: how well can we monitor this self-quarantine, and how well we can, implement it so that people who have nothing to do, with medical activities or peacekeeping activities could be saved, from this danger? Thank you.
And I listened very carefully to what you've just said, and I really cannot comment on what has happened in individual cases, but I can make a general remark. The situation is that people who have been very much in contact with individuals who have got Ebola infection are increasingly being asked by national governments to put themselves in a situation where they regularly test their temperatures or have their temperatures tested, and then if signs develop of infection, that they then immediately subject themselves to medical examination. And this is the guidance. I do not have any information at all about whether or not individuals have followed this guidance. The guidance also has recently been promulgated in certain countries, and I can only simply report that and say that that represents good health practice. But the performance of individuals in relation to that practice is something, unfortunately, on which I have no information.
Nizar?
Yeah, on the same point, Nizar Abu Al Mayadeen television in Lebanon. On the same point, in the incubation period is 21 days.
Yes.
When can you tell that someone is infected or has some symptoms? Is it in the early days? Is it in the middle or in the later days?
Thank you very much indeed. The situation with this particular infection, according to the World Health Organization, is that people are infectious when they have signs of the disease. And signs of the disease start with a fever and then continue to certain other immediate discomforts, and then at a later stage with physical disturbance, some of which I don't really want to go into in detail, but it is associated with production of fluids from different directions. Now, you are not infectious, according to the guidance from the WHO, when you do not have these signs of infection. And so that is why the use of temperature and also examination to look for other clinical signs is the primary mechanism through which people's infectiousness is determined. I think that's an answer to your question. It looks as though you want to ask a follow-up.
Here, I mean, establishing whether someone needs a quarantine or not will depend mainly on his revelation that he suffers from ailment or from fever or any kind of symptoms. So here, the risk for the authorities to establish, and it's incumbent on them to protect their citizens.
Yes.
Is they need to take precautions, and you cannot blame them if they quarantine people who come from infected areas. Because, as you said, it's difficult to establish if someone is infectious or not until he reveals that and shows it willingly.
So I just want to be precise that what I said, and will repeat it, is that this disease, an individual who is affected by this disease is infectious when they have signs of infection. And that means when they have a temperature or have other evidence that they are ill. And these signs of infection are detected by examination. And that is why the request is that people either self-examine or examined by professionals to see whether or not they've got a temperature. We're not here referring to history or symptoms, we're referring to signs which include fever and then other physical manifestations of illness. I think that that's understood, and I'm quite happy to have a further discussion with you outside to get this absolutely clear. It's a super important point.
All right, the gentleman in the back, and that'll have to be the last question, unfortunately, but we'll get Dr. Nabarro back.
Thank you very much. Femi Akonde from TVC News, Lagos, Nigeria. I would like to ask, what's the most challenging part of the whole global response against Ebola? Is it in preventing the spread or treating cases of, or treating patients of Ebola?
You know, this is a complex response because there are many different pieces that have to be in place. Number one is that societies need to understand what it is that leads to infection with Ebola and to take action to reduce that infection. In your country, Nigeria, there was a massive social mobilization around Ebola, which was crucially important in contributing to the cases that you had being managed and the outbreak being brought quickly under control. The second immediate need is that when individuals are ill, they have to be able to access good quality treatment. That means that they are most likely to survive, and that in turn makes it much easier to get people to want to come into treatment quickly because they perceive that they're going to do well and survive. Lastly, number three, we also have to be able to identify the contacts of people who are shown to be infected and keep them under surveillance and make sure that they too don't get ill. So contact tracing is particularly important and requires a very sophisticated level of organization. Taken together, community engagement, treatment, contact tracing represents the main elements of Ebola outbreak control, all of which were done very well in Nigeria, and all of which need to be practiced everywhere where there is an outbreak. Thank you.
Thank you very much, David. Thank you.